Can you tell us about how parents can go about a diagnosis after newborn screening for their child?
So, since newborn screening covers all children, ideally, the results usually come back as a definitive no, nothing is wrong with the child, or possibly something is not right about the test. So it's either marked as a failed test or alert for another test. So since this is a screening test and not a diagnostic test, the doctor who is in charge of the baby's care calls back the parents and repeats the test or does a confirmatory test. The confirmatory test may be a genetic test or another biochemical or metabolic test. Once this test comes back positive again, we would know that the child would require treatment for that particular disease, and the parents would need to be counselled either at the primary center or in a specialist center. The exception to this is if there is a suspicion of congenital hypothyroidism. As soon as a screen test comes as failed or alerted, it's mandated that the child is started on thyroid supplements and then confirmation is done so that no time is wasted.
So the set of tests that are being done in a newborn screening, so how do you account for those tests? Say, are these tests only diagnostic or are they treatable and manageable as well?
Because it's called newborn screening, they are still screening tests and not diagnostic tests. Diagnostic tests are more expensive and limited to the few people that come back failed for a test. It is important to remember that everybody that fails the initial screen is not likely to be affected. There are other reasons why it may come as a fail the first time. And only a small fraction of those individuals will actually have a disease that needs to be treated. But you do need a specific diagnostic test, and these are usually done in specialized centers more centrally.
Okay. So when someone is positive even at this level of a diagnostic test, so are these diseases treatable?
So since we don't have a universal program in place, I think this is more of a theoretical question. But most countries choose those diseases that have a specialized, specific treatment which stops the progress of the disease and stops the harmful effects of an untreated disease. So we have to be careful about starting treatment as early as possible in children that are diagnosed positive.
Can you give us an example of a disease that can be treated?
Yes, I think the easiest example is what was used in the screening protocol by ICMR, and that is congenital hypothyroidism. For a child that tests positive for congenital hypothyroidism, the cost per day of replacing oral thyroid medication is less than 50 paisa per day. But it ensures that the child's intellectual capacity and growth is maintained well if we pick it up in an ideal phase. The more difficult diseases are like metabolic disorders called phenylketonuria or PKU for short. In this condition, a single amino acid is not being metabolized. This is a unit which makes a protein, and the side effects of the disease involve losing intellectual capacity and the child getting fits. There is a effective diet, which excludes this particular amino acid, and if it is started early enough in the child, there should be normal growth and normal development.